Hi, I'm Ms. Quoted. Thank you for stopping by today. Today, we're going to be talking about how do I find a physical therapist who understands hypermobility Ehlers-Danlos? Well, let's start with the easy button. If you go to the Ehlers-Danlos Society on their support tab, they have a find a doctor or a therapist. Now, this isn't an exhaustive list. For example, my physical therapist didn't sign up for the listings because she'd already established herself in our local community of hEDS patients before this list was ever reached. But maybe you live in an area that nobody's listed or you want to explore more options. How do you find your physical therapist? Well, unfortunately, in the United States, a lot of physical therapy centers are not tailored to treating people with hypermobility. It's a lot more efficient to treat someone who's recovering from an acute problem, like a broken bone, and their services tend to be run more for those patients with the acute problems in mind. People with chronic conditions like hypermobility need one on one interaction with a physical therapist who can watch how you're moving your body. And each of us with HEDS has these unique little quirks in how we move, and we need that physical therapist's expertise who will take the time to understand our specific needs. This type of one on one service is sometimes called concierge medicine. Regardless of the branding, a key term to watch for in physical therapist biography is someone who follows a school of thought called movement system impairment, or MSI, or another a similar system called movement system analysis, MSA. This school of physical therapy looks at functionality over pathology. The reality is that more than 80% of people are anatomically different than what a textbook says. So, this school of philosophy decides that it should, learn from the textbook, it should understand the textbook, but then it should toss it aside. And the physical therapist should use their eyes and their brains to understand how a patient's actually using their body to understand what needs to be fixed with that patient. When you contact a physical therapist, ask about continuing education or CE credits. Ask the physical therapist if they've taken any CE for understanding hypermobility. If they say they haven't, that's okay. Ask them if they'd be willing to take some CE credits before meeting with you and during the duration of your treatment with them. If they can't agree to that, dodge the bullet, move on to somebody else. I personally benefited from my PT's CE course. I had been having issues with my knee subluxating. A subluxation is a joint dislocation without nerve, blood vessel, or other soft tissue damage, which would be a full dislocation. My knee kept popping out of joint every few months for a year and a half. My physical therapist and I kept adding exercises to stabilize the knee. Then she took a CE course about knee issues in patients with hypermobilities, and we learned about rotation of the tibia bone. We did an activity to observe if my tibia was rotating, and we found it was in fact my fibula rotating. The way to fix my knee wasn't strengthening the knee, it was ankle stabilizing exercises. And since started doing the ankle stabilizing exercises, I haven't subluxated my knee in almost 2 years. The CE didn't teach my physical therapist my solution, but it got her asking different questions, and her observations and understanding of body mechanics found a solution for me. Another thing you might look for in your search for a physical therapist is someone who focuses on dancers, gymnasts, and circus arts performers. These are athletics that attract people with hypermobility, and the PT is just more likely to have encountered and understand the difference between hypermobility and flexibility. Do not work with anyone who says, wow, you're so flexible. That statement shows they don't understand the difference between what a hypermobile joint is and what a flexible muscle is. When you are flexible, your muscles stretch. When you are hypermobile, you are moving your body out of joint. Another red flag to look for is physical therapy center that schedules like 3 overlapping patients with a physical therapist and then relies on a student aide to supervise the patient instead of the physical therapist. No, you need a physical therapist who understands all 600 plus muscles in your body, where these muscles attach, how they act on your body, how the ligaments and tendons interact with your body, and how your nerves may be interacting with it all. You know that bone song that kids sing, the hip bone's connected to the thigh bone? In HDDS, the chain of connection is so important to understand. Remember how we were just talking about my knee problems that were really an ankle problem? Like that's one example. Another example is I have a friend who has HEDS as well. She was having shoulder pain for months. Turned out her gracilis, the inner thigh muscle, was tight, and that inner thigh muscle was pulling on her back muscles, and the back muscles were pulling on her shoulder muscles. It makes no sense. Your shoulder pain's caused by your inner thigh. Like, we wouldn't come up with that. That is why we need a physical therapist who can figure out our crazy hEDS mysteries. You want someone who is curious and analytical, and they can really help you learn your body.